Welcome back to Physio Vibes. In this video we are going to look at
Torticollis, neck and physiotherapy management.
Before we start, hit the subscribe button for more videos. Press the bell icon and never miss another update.
Torticollis, neck and physiotherapy management. Torticollis is a cervical condition which is either congenital or spasmodic acquired. In this, head flexed towards the shoulder of one side, and face turned to opposite side. Clinical picture of torticollis. Types of torticollis. 1. Congenital. There are two causes for congenital torticollis. A muscular cause, shortening of sternomastoid muscle due to presence of tumor in the muscle, either due to arterial obstruction or spasm, or venous occlusion resulting into ischemia. Postural cause, malpositioning of fetal neck in uterus. 2. Acquired. It is also referred as neck.it. Basic cause may be O. Acute inflammation of cervical muscles. B. Spasm of cervical muscles, particularly sternomastoid muscle. C. Hysterical. Clinical features. Head flexed towards the shoulder of one side, and face turned to opposite side. In cervical region, there is scoliosis with convexity to the sound side. Head is protruded forwards with raised shoulder of the affected side. Treatment. In a child presenting with a sternomastoid tumor, progress to torticollis can be prevented by passive stretching and splinting. The same may also be sufficient for mild deformities in younger children. For severe deformities, especially in older children, release of the contracted sternomastoid muscle is required. It is usually released from its lower attachment, but sometimes both attachments need to be released. Following surgery, the neck is maintained in the corrected position in a Callot's cast. Physiotherapy measures for torticollis. Our physiotherapy depends upon how early cases referred to as. 1. Early cases of childhood are of mild variety, and so can be corrected by physiotherapy. A. To relieve pain, heat modality can be applied which will induce relaxation of the muscles. B. Relaxed passive movements of head in the opposite direction of affected muscles. C. Gradual active movements of the cervical spine should be followed. D. These exercises are then followed by a temporary collar given during working activities, and sleep to maintain the correct posture. Home advice. It is important to teach the mother properly to repeat, maintain the manipulation correctly and along with correct positioning. While sleeping, the child's head should be on the opposite, and deformity supported by pillows. Older chronic cases. As that becomes older, the deformity becomes irreversible, and thus the only treatment is surgical intervention. Physiotherapy after surgery. Measures to control pain. This is done by thermotherapy, hydrotherapy, etc. Exercises. Active Rome exercises to the sternomastoid muscle are encouraged. Supportive devices like cervical collar should be used till adequate correction is required. Additional measures like self-correction, adopting a changed proper posture at work, etc.
Thanks for watching. Don't forget like, share and subscribe.